Q1. You were on your medication rounds and the emergency alarm goes off. What will you do first? Lock your trolley. Rush to your patient's bedroom. Check first if everyone had their meds. ANC Q2. An adult woman is admitted with metabolic acidosis. Which set of arterial blood gases should the nurse expect to find in a client with metabolic acidosis? pH 7.28, PCO2-55, HCO3-26. pH 7.50, PCO2-40, HCO3-31. pH 7.48, PCO2-30, HCO3-22. pH 7.30, PCO2-36, HCO3-18. Q3. A client has a diabetic stasis ulcer on the lower leg. The nurse uses a hydrocolloid dressing to cover it. The procedure for application includes cleaning the skin and wound with betadine, removing all traces of residues for the old dressing, choosing a dressing no more than 1/4 inch larger than the wound size, holding in place for 1 minute to allow it to adhere. Q4. The nurse is reading a healthcare provider's HCP progress notes. In the patient's record reads that the HCP has documented insensible fluid loss of approx 800 milliliters daily. The nurse interprets that this type of fluid loss can occur through which route? The skin, urinary output, wound drainage, the gastrointestinal tract. Q5. A client wants to leave the hospital. The medical team is not happy with his clinical condition and judgment as per the Mental Health Act. What will you do? Let the client leave the hospital as he does not pose any threat to the public or is visibly ill. Inform the security to hold the patient and not let him go away. Inform the police. Counsel the patient to stay back in the hospital for his betterment. Q6. Which of the following actions would place a client at the greatest risk for a shearing force injury to the skin? Walking without shoes. Sitting in Fowler's position. Lying supine in bed. Using a heating pad. Q7. In a hospital, routine precautions are the responsibility of doctors and nurses only. True. False. Q8. An antihypertensive medication has been prescribed for a client with HTN. The client tells the clinic nurse that they would like to take an herbal substance to help lower their BP. The nurse should take which action? Tell the client that herbal substances are not safe, should never be used. Teach the client how to take their BP so that it can be monitored closely. Encourage the client to discuss the use of an herbal substance with the healthcare provider. Tell the client that if they take the herbal substance, they will need to have their BP checked frequently. Q9. The most important procedure for the prevention of infection from germs and viruses is wearing gloves, properly bagging used linen, effective hand washing, wearing protective eyewear. Q10. Contact precautions are initiated for a client with a healthcare-associated infection caused by MRSA. Which protective equipment the nurse should wear while providing colostomy care? Gloves, gown. Gloves, goggles. Gloves, gown, shoe protectors. Gloves, gown, goggle, face shield. Q11. When trying to make a responsible ethical decision, what should the nurse understand as the basis for ethical reasoning? Ethical Principles Code. The nurse's experience. The nurse's emotional feelings. The policies practices of the institution. Q12. Nurses who seek to enhance their cultural competency skills and apply sensitivity toward others are committed to which professional nursing value. Autonomy. Strong commitment to service. Belief in the dignity and worth of each person. Commitment to education. Q13. A client diagnosed of cancer visits the OPD and after consulting the doctor breaks down in the corridor and begins to cry. What would the nurse's best action? Ignore the client and let her cry in the hallway. Inform the client about the preparing to come 40 next appointment for further discussion on the treatment planned. Take her to a room and try to understand her worries and do the needful and assist her with further information if required. Q14. A 27-year-old adult male is admitted for treatment of Crohn's disease. Which information is most significant when the nurse assesses his nutritional health? Anthropometric measurements. Bleeding gums. Facial rubor. Dry skin. Q15. The code is concerned about focusing on which of the following criteria? Clinical expertise. Conduct, behavior, ethics, professionalism. Hospital policies. Disciplinary actions. Q16. Gowns and gloves should not be worn in common use areas such as nursing stations, eating areas, and elevators. True. False. Q17. You must wash your hands after removing your gloves. True. False. Q18. What is the purpose of clinical audit? It helps to understand the functioning and effectiveness of nursing activities. Helps to understand the outcomes and processes for medical and surgical procedures. Helps to identify areas of improvement in the system pertaining to nursing and medical personnel. Helps to understand medical outcomes and processes only. Q19. You are assisting a doctor who is trying to assess and collect information from a child who does not seem to understand all that the doctor is telling and is restless. What will be your best response? Stay quiet and remain with the doctor. Interrupt the doctor and ask the child the questions. Remain with the doctor and try to gain the confidence of the child and politely assess the child's level of understanding and help the doctor with the information he is looking for. Q20. When communicating with a client who speaks a different language, which best practice should the nurse implement? Speak loudly slowly. Arrange for an interpreter to translate. Speak to the client family together. Stand close to the client, speak loudly. Q21. The nurse is caring for a patient with heart failure. On assessment, the nurse notes that the patient is dyspnoic, crackles are audible on auscultation. What additional signs would the nurse expect to note in this client if excess fluid volume is present? Weight loss. Flat neck, hand veins. An increase in BP. Decreased central venous pressure, CVP.
Please don't forget like and subscribe. Thank you.
Q22. Your patient has diverticulitis for about a decade now. You have assessed her to be having soft stools of type 4/5. Which of the following will need urgent intervention? She is losing a lot of electrolytes in her body, and this needs to be replaced. There is no urgency in this case, because patients with diverticulitis are expected to have soft to loose stools. She needs to be prescribed with fluid retention pills. There is no urgency in this case because the stool is quite hard, and it should be fine. Q23. A client is admitted to the emergency department after a motorcycle accident that resulted in the client skidding across a cement parking lot. Since the client was wearing shorts, there are large areas on the legs where the skin is ripped off. This wound is best described as abrasion, unapproximated, laceration, eschar. Q24. While brushing the teeth, the nurse observes bleeding gums in the client. The nurse understands that the probable cause for this gingivitis is poor diet, poor flossing, poor tartar removal, infection. Q25. A nurse is not trained to do the procedure of full cannulation, still she tries to do the procedure. You are the colleague of this nurse. What will be your action? You should tell that nurse not to do this again. You should report the incident to someone in authority. You must threaten the nurse that you will report this to the authority. You should ignore her act. Q26. A client with CVA is found to have difficulty in swallowing. Whom do you think should be informed for further assessment? Neurological physiotherapist, occupational physiotherapist. Q27. Masks and goggles must be worn for care activities such as care of patients who have a cough or are vomiting. True. False. Q28. A client's wound is draining thick yellow material. The nurse correctly describes the drainage as sanguineous, serous sanguineous, serous, purulent. Q29. The charge nurse observes a new staff nurse who is changing a dressing on a surgical wound. After carefully washing her hands, the nurse dons sterile gloves to remove the old dressing. After removing the dirty dressing, the nurse removes the gloves and dons a new pair of sterile gloves in preparation for cleaning and redressing the wound. The most appropriate action for the charge nurse is to interrupt the procedure to inform the staff nurse that sterile gloves are not needed to remove the old dressing. Congratulate the nurse on the use of good technique. Discuss dressing change technique with the nurse at a later date. Interrupt the procedure to inform the nurse of the need to wash her hands after removal of the dirty dressing and gloves. Q30. The use of gloves is an effective substitute for hand washing. True. False. Q31. A mentally competent client with end-stage liver disease continues to consume alcohol after being informed of the consequences of this action. What action best illustrates the nurse's role as a client advocate? Asking the spouse to take all the alcohol out of the house. Accepting the patient's choice, not intervening. Reminding the client that the action may be an end-of-life decision. Refusing to care for the client because of the client's non-compliance. Q32. The nurse is preparing to care for a patient with a potassium deficit. The nurse reviews the patient's record, determines that the client was at risk for developing the potassium deficit because of which situation. Sustained tissue damage. Requires nasogastric suction. Has a history of Addison's disease. Is taking a potassium-retaining diuretic. Q33. Standard precautions are the daily practices, e.g. hand washing, use of personal protective equipment, cleansing of equipment, that will reduce the transmission of infections. True. False. Q34. A young adult is being treated for second and third degree burns over 25% of his body and is now ready for discharge. The nurse evaluates his understanding of discharge instructions relating to wound care and is satisfied that he is prepared for home care when he makes which statement: "I will need to take sponge baths at home to avoid exposing the wounds to unsterile bath water. If any healed areas break open, I should first cover them with a sterile dressing and then report it. I must wear my job's elastic garment all day and can only remove it when I'm going to bed. I can expect occasional periods of low-grade fever and can take Tylenol every 4 hours." Q35. The nurse is preparing to change the parenteral nutrition (PN) solution bag tubing. The patient's central venous line is located in the right subclavian vein. The nurse asks the client to take which essential action during the tubing change: breathe normally, turn the head to the right, exhale slowly evenly, take a deep breath, hold it bear down. Q36. A fully alert, competent 89-year-old client is in end-stage liver disease. The client says, "I'm ready to die," refuses to take food or fluids. The family urges the client to allow the nurse to insert a feeding tube. What is the nurse's moral responsibility? The nurse should obtain an order for a feeding tube. The nurse should encourage the client to reconsider the decision. The nurse should honor client's decision. The nurse must consider that the hospital can be sued if she honors the client's request. Q37. Which of the major theories of aging suggests that older adults may decelerate the aging process? Disengagement theory, activity theory, immunology theory, genetic theory. Q38. Which professional organizations are responsible for establishing the code? NHS, NMC, American Nurses Association, National League of Nursing, and American Association of Nurse Executives. State boards of nursing, state and national organizations, and specialty organizations. Q39. Who among the list below are more prone to coronary artery disease, hypertension, smoker, DM, obese women, non-sedentary lifestyle? Hypertension, smoker, DM, obese men with non-sedentary lifestyle. Hypertension, smoker, obese men, sedentary lifestyle. Q40. The nurse is assigned to care for a group of patients. On review of the patient's medical records, the nurse determines that which patient is at risk for fluid volume excess. The patient taking diuretics. The patient with kidney disease. The patient with an ileostomy. The patient who requires gastrointestinal suctioning. Q41. The objective of standard precautions is to prevent the spread of infection within the healthcare institution, from patient to patient, from patient to staff, from staff to patient, from staff to staff. All of the above. Q42. You are training the staffs on medication errors. Which is the most common error that occurs due to stressful clinical environment? Wrong dose and identity. Failure to capture allergies. Wrong contraindications. Wrong constitution of drug. Q43. Black wounds are treated with debridement. Which type of debridement is most selective and least damaging? Debridement with scissors. Debridement with wet to dry dressings. Mechanical debridement. Chemical debridement. Q44. An adult who has gastroenteritis is on Digitalis has lab values of K 3.2 MEQL, Na 136 MEQL, Ca 4.8 MEQL, Cl 98 MEQL. The nurse puts which of the following on patient's plan of care? Monitor for hyperkalemia. Avoid foods rich in potassium. Observe for Digitalis toxicity. Observe for Trousseau-Chvostek's signs. Q45. A client is diagnosed with methicillin-resistant Staphylococcus aureus pneumonia. What type of isolation is most appropriate for this client? Reverse isolation. Respiratory isolation. Standard precautions. Contact isolation. Q46. The nurse cares for a client with a wound in the late regeneration phase of tissue repair. The wound may be protected by applying a transparent film, hydrogel dressing, collagenase dressing, wet to dry dressing. Q47. Several clients are admitted to an adult medical unit. The nurse would ensure airborne precautions for a client with which of the following medical conditions? A diagnosis of AIDS and cytomegalovirus. A positive PPD with an abnormal chest X-ray. A tentative diagnosis of viral pneumonia. Advanced carcinoma of the lung. Q48. One of your healthcare assistants came to you saying that she could not continue with her rounds due to a bad back. What will you do first? Document the incident and report to the manager. Ring for agency staff to cover the shift. Assess your colleague's back and administer painkillers. Send her home and cover her work yourself to help the team. Q49. The client at greatest risk for postoperative wound infection is a 3-month-old infant postoperative from pyloric stenosis repair, a 78-year-old postoperative from inguinal hernia repair, a 18-year-old drug user postoperative from removal of a bullet in the leg, a 32-year-old diabetic postoperative from an appendectomy. Q50. You are nurse at the community care center and an elderly complains to you that his neighbor is stealing money from him. He sends his for shopping and sometimes the neighbor does not shop and keeps the money with him. You will confront the neighbor when he visits you next time. Remain quiet and ignore the complaint. Request the elderly to talk to the hospital chaplain for further assistance. Raise a complaint in the incident report form and investigate the matter and inform the concerned.